Have you ever thought about this? A surgeon performs a perfect surgery. I mean, technically flawless. But then, the patient just doesn't heal. It's this incredibly frustrating puzzle in medicine. And the answer is hiding in plain sight, or rather in something we can't see at all. Today, we're going to get into exactly why that is.
So, picture this. A surgeon does an amazing job restoring blood flow to a patient's leg. Everything looks great on the scans. But weeks go by, and a wound on their foot just refuses to close. This is a super common and, frankly, heartbreaking reality for people with something called peripheral arterial occlusive disease, or PAD. It really makes you wonder, right? If the main arteries are wide open, why isn't the healing kicking in?
So PAD is basically when your arteries get narrow, cutting down the blood supply, usually to your legs and feet. Now, doctors have some pretty incredible tools, like angiography, that give them this crystal clear map of the big, main arteries. They can find a blockage, open it right up, and see the blood rushing through. But that's only part of the story.
To really get what's going on here, we need a good analogy. Let's think about your body's entire circulatory system, like a city's road network.
Okay, this slide right here is the key to everything. The big arteries, that's the macrovasculature, they're the major highways. Our current tools are great at checking for traffic jams on these highways. But the actual healing, the delivery of oxygen and all the good stuff, that happens in the microvasculature. These are the tiny little neighborhood streets, and just because the highway is clear doesn't mean the delivery truck is actually making it to your front door.
And that is the core of the problem. A surgeon can clear the highway, a technical success. But if all those little neighborhood streets are blocked off, nothing gets delivered and the wound won't heal. That's a clinical failure. This whole disconnect is why scientists are racing to develop new tools to see into the microvasculature, to finally check the traffic on those vital local roads. All right, so the first batch of tools we're going to look at are the invasive ones. Now, these give us a really incredible, detailed picture, but just like the name says, they require going inside the body, usually with things like contrast dyes.
First up is CT perfusion. This thing uses a CT scanner and an injectable dye to create these amazing color-coded maps of blood flow right down to the tissue level. In our city analogy, this is like getting a super high-resolution real-time satellite map of all the traffic.
But, there's always a trade-off. The detail you get is fantastic, absolutely top-notch. But it comes with a price. The procedure uses ionizing radiation, and it is invasive. So it's not something you can just do every day to check on a patient's progress.
Next, we've got near-infrared fluorescence imaging, or NIRF for short. This is super cool. It's a real-time technique where they inject a special dye called indocyanine green. Then, under a special camera, that dye actually glows, literally lighting up the blood flow for the surgeon, right there in the middle of the operation.
The huge advantage here is that it's happening in real time with zero radiation. A surgeon can see immediately if blood flow to the skin has gotten better. But look at that one big limitation: low penetration depth. It can only see a few millimeters deep. So while it's amazing for checking skin, it can't tell you a thing about what's happening in the deeper muscle tissue.
Okay, so if the invasive tools have their drawbacks, what about ways to see what's happening without ever breaking the skin? This next group of non-invasive techniques, well, they feel a little bit like something out of science fiction. So, let me introduce you to hyperspectral imaging. This is basically a super-powered camera that can literally see the oxygen levels in your skin. And the best part? It's completely non-contact and totally painless.
So here's the breakdown. The camera shines a light on the skin, and then it analyzes how that light gets absorbed by hemoglobin, the molecule carrying oxygen in your blood. Based on that, it instantly creates a map that shows exactly where oxygen is being delivered and where it isn't. Because it's so quick and you don't have to touch the patient, it's perfect for tracking how a wound is healing over time across multiple doctor visits.
And finally, we have a technology that a lot of us have probably seen before, but it's being used here in a really clever way: thermal imaging.
The idea behind this is so simple, it's kind of beautiful. Blood is warm, so good circulation brings that warmth up to the surface of the skin. Poor circulation? Well, that leaves the skin feeling cold. A thermal camera can spot these tiny temperature differences with incredible accuracy, giving doctors a quick, visual snapshot of blood flow.
And just how good is it? Get this. One study found that after a bypass surgery, a temperature drop of just 2 degrees Celsius in the foot was a massive red flag.
It actually predicted that the bypass graft would fail with 100% sensitivity. Wow, that's an unbelievable insight from what is basically just a picture of heat. So we've looked at a bunch of different technologies, and you can see that each one has its own pros and cons. This all leads us to the big question that researchers are trying to answer right now.
If we could take all the best features from everything we just talked about and mash them together, what would that perfect gold standard tool actually look like for doctors and for patients?
Well, the dream tool would be completely non-invasive, of course. It would be fast, and it would be cheap. A doctor could use it before an operation to see if it's even necessary, use it during the procedure to see if what they're doing is working in real time, and then use it after to monitor healing. But most importantly, it would finally give them that one piece of the puzzle they've been missing, a reliable way to predict if the patient is actually going to heal.
And you should know, this isn't just some fantasy wish list. There is a real, global effort happening right now to make this a reality. The ultimate goal is to make this kind of advanced perfusion measurement a standard, everyday part of care for every single patient with vascular disease.
And that leaves us with this one last really amazing thought. With technologies like hyperspectral and thermal imaging, we're getting so much closer to a future where something as simple as taking a picture could tell us everything we need to know about our body's ability to heal itself. A future where we can finally, truly see what matters most.